Usually the clinician tend to use in their clinical practice guidelines. Guidelines are regularly updated, but probably guidelines are not able to capture some characteristics of patients. In other words, they are unable to capture the logistics of patients. They are unable not to capture the fact that the patient is able to be supported by a caregiver. Also, specific comorbidities are not specifically analyzed in the guidelines. So at the end, there is the need to bridge a gap between guidelines and clinical practice. So, looking at the therapy, we try to identify 4 different categories. The first categories are therapies that are really highly recommended. So, the therapy that are recommended, the therapy that are feasible, and finally the therapy that are not recommended. What does it mean? It means that this type of categorization was done using all different components of that can be used for choosing the therapy, not only the characteristic of disease and characteristic of patients, but also logistics and what is the support of the patient, and importantly, what is the life expectancy of the patient, because probably the choice can be modulated also according to this point. There is an important point, finally, that we need probably, obviously, what you have proposed is just a purpose, so it is able to generate some hypotheses. But it's important also that guideline can be informed, but what is the patient preference? And I think that we need to get more information about studies based on discrete choice experiments.